Thank you very much, Mr. Chairman. And I just want to note at the outset our focus on bipartisanship. We began that with our effort to go after price gouging with hepatitis C. Recently, we've gone after manufacturers ripping off Medicaid. You noted our intervention to look at insulin prices that just soar and soar and soar some more. So I just very much appreciate the fact that we're tackling this in a bipartisan way. Colleagues, prescription drugs did not become outrageously expensive by accident. It's not the result of a system too complicated for Americans to understand. Drug prices are astronomically high because that's where pharmaceutical companies and their investors want them. The brakes have come off pharmaceutical pricing, and American families are hurtling along in the passenger seat, terrified about what comes next. Today, the committee is going to hear about uplifting stories and miracle cures. Yet it's morally repugnant when patients can't afford those miracles. It's morally repugnant when ailing patients are forced to choose between filling the next prescription or putting food on the table because they can't afford both. It is morally repugnant when patients are forced to skip doses. Pharma executives, all of you that are here today, are here because the way you've been doing business is unacceptable. 10 companies accounted for half of all the profits in the healthcare sector last year. 9 of them were drug manufacturers. All but one of today's witnesses represent companies on this list. Drug makers behave as if the patients and the taxpayers are unlocked ATMs full of cash to be extracted, and the shareholders are the customers that they value above anybody else. So I'm going to go through a short list of examples, starting with AbbVie, that manufactures the top-selling prescription drug in America, the arthritis medication Humira. Over 6 years, the company doubled the price of a 12-month supply from $19,000 to $38,000. Can the patients opt for a less expensive alternative? They can't, because AbbVie protects the exclusivity of Humira like Gollum with his ring. Thick cobwebs of patents and legal tricks and shadowy deals with other drug makers. All of them are in place to keep the cash flowing. Now, I also want to address some very troubling information we just got. AbbVie's proxy statement. It's a document every publicly traded company has to file with the SEC. Page 37 shows that in 2017, a portion of CEO Richard Gonzalez's multi-million-dollar bonus was directly tied to sales of Humira. It appears the same incentive was in place in 2015 and 2016. In fact, the committee's review shows that all of AbbVie's top executives had the same arrangement. Mr. Gonzalez is welcome to respond, but the implication ought to be clear. From top down, AbbVie's leadership had reason to keep pushing prices and sales up. Now, Pfizer, that company gets first prize for the emptiest pricing gesture in 2018. After Stern Trump tweets, Pfizer said it would temporarily freeze the prices. But once the president got his splashy headlines, his gaze went elsewhere. Pharmacy's former CEO told investors it was back to normal. Another round of price hikes in 2019, including the pain medication Lyrica. Lyrica has increased 163% in price since 2012. Just one drug allowed Pfizer to pull in $4.5 billion in 2017. Merck gets second prize for emptiest pricing gesture of 2018. They made sweet-sounding promises after coming in under criticism but they cut prices for drugs that essentially produce no revenue for the company. Left untouched were the cash cows, Keytruda and Januvia, which account for more than a quarter of the company's revenue. It's like promising car shoppers a great deal, except the only discounted model on the lot is an Edsel. Sanofi, this is a company wringing more and more cash out of people with an incurable disease. In 2010, a vial of this insulin cost less than $100. In 2018, it cost nearly $300. The company raised prices again in 2019. Considering the landmark breakthrough on insulin came early in the roaring 20s, nothing could justify this sudden price hike a century later. Diabetics who can't afford the costs now self-ration and endanger their lives. But you know what? The investors are happy. AstraZeneca, a lesson in saying the quiet part out loud. In an interview earlier, the CEO complained that his $12 million salary made him the lowest paid CEO in the whole industry, and he said it was annoying to some extent. His company, meanwhile, continues to raise the price of Symbicort, its $3 billion asthma drug. For some asthmatics, being able to breathe costs hundreds of dollars a month. And Johnson & Johnson gets the record today for flip-flopping. This January 7th at the J.P. Morgan Health Conference, the CEO said the pharmaceutical industry needs self-policing on prices. That sounded good, but 3 days later, the company hiked the prices of hundreds of its drugs, including drugs that account for billions in Medicare spending. And finally, there's Bristol Myers Squibb. In 2017, the company spent roughly $11 billion on dividends, stock buybacks, marketing, sales, and administrative costs that roughly triple the amount spent on R&D. Now, I'm going to close by saying I want us to compare these concrete examples of two-faced scheming and profiteering with the central arguments that we are going to get this morning. The central argument is basically from Pharma, the fault is always somebody else's. The health plans are at fault. The pharmaceutical benefit managers are at fault. Regulators are at fault. What we know for certain is the history that pharma CEOs always say somebody else is at fault. And we're also going to hear that the list price doesn't matter, that the true costs are just so complicated. But companies don't set and raise list prices for fun. Those prices are directly tied to the amount patients pay out of pocket at pharmacy windows from sea to shining sea. They're directly tied to what taxpayers spend on healthcare programs. Then drug makers point the finger at middlemen, the pharmacy benefit managers. I have said for years, these pharmacy managers are wasteful and secretive, take their cut without proving their worth to anybody. They're going to have their day before the committee, too. But those pharmacy managers don't set list prices. The manufacturers do. And by the way, the manufacturers don't offer rebates for nearly 40% of Part D brand name drugs. Those prices are going up. That's on the drug companies, not on the pharmacy managers. We're also going to hear that any changes in business as usual hurt research and development. A quick look at company finances shows that that's a fable. Revenue generated from American patients alone dwarfs what they spend on R&D worldwide. Drug makers spend as much, if not more, on those exhilarating TV ads and office-to-office salesmen as they spend on research and development. And if lower prices would diminish R&D, why don't costly dividends? Why don't stock buybacks? Is the stock price more important than inventing that next miracle cure, even if you buy the specious argument that a drug price's list price at launch is driven by research costs. What could justify arbitrary price increases year after year, long after the research and development spending is done? Finally, we're going to hear about how patients can get coupons. But if this was so generous, why can't drug companies just lower prices across the board? I believe it's just more slick branding that allows companies to keep the status quo cash cow rolling along. I'll close with this. I was there when 7 big tobacco CEOs testified in a committee room just like this one. They lied that day. This committee, the chairman and I, expect better than that this morning. Your profits are outsized compared to others in the industry. You get a massive portion of your revenue from American taxpayers, and you bear none of the consequences of these skyrocketing prices. It is long past time to drop the excuses and take concrete action to make medicine in America more affordable. Thank you, Mr. Chairman.
Yeah.